What if the person you love most lost their ability to move, and the only thing standing between their safety and harm was you? Now, imagine you have no medical training, no emotional support, and no idea what to do. That's the daily reality for millions of caregivers across the world. Invisible heroes who hold our health system together. By 2030, 1 in 6 people will be over 60 years old. That's 1.4 billion seniors worldwide. By 2050, the number will double, and those with over 80 will triple. In Colombia, there are 7.6 million people over 60, and 21% live with a physical disability. Most rely on family members who are unprepared, overwhelmed, and anxious, and the result is burnout, preventable hospitalization, and emotional distress. Our headline is simple: VitAlly transforms caregiving from burden to empowerment.
Caring for an older adult isn't just about physical assistance. It's a 24-hour responsibility that affects every aspect of a caregiver's life. They face physical exhaustion, emotional isolation, financial stress, and the fear of making mistakes that could harm their loved ones. In Colombia, caregivers often have no access to structured training, no emotional guidance, and no support networks. Health institutions struggle to provide follow-up, and the system becomes overloaded. So we asked ourselves, how can we equip caregivers with the right knowledge, tools, and community to care safely without adding more cost to the system?
Our answer is VitAlly, a comprehensive hybrid platform designed for caregivers of older adults with physical disabilities. It combines digital tools and offline support to ensure no caregiver is left behind, whether in Bogota or a rural village. Our digital features are app with personalized learning paths and tutorials validated by professionals, 24/7 AI chatbot for guidance, reminders, and emergencies, video consultations with nurses, physiotherapists and psychologists within 48 hours, emotional support corner with a stress reduction resource, and progress tracker for caregiver skills and patient outcomes. And our offline features are toll-free support line available anytime, printed care guides distributed through hospitals and communities, and local workshops to train caregivers in person.
VitAlly provides an all-in-one ecosystem for caregivers: physical, emotional, and occasional support in one place. It creates value at 3 levels. For caregivers, reduce anxiety, increase confidence, and improve quality of life. For patients, fewer complications, faster recovery, and more personalized care for the healthcare system. Fewer prevalent hospitalization, lower cost, and better patient outcomes. If we train and support even 10% of Colombian caregivers, we can reduce avoidable hospital admissions by 50 to 20% and save millions in healthcare costs annually.
Unlike other initiatives, VitAlly isn't just a training app. It's a comprehensive ecosystem that combines education, psychological support, and professional consultation. Hybrid access, ensuring inclusion in both urban and rural areas. Clinical validation, as content is created with medical professionals. Community network that connects caregivers with mutual support and shared learning. Personalized dashboards for EPS and IPS to monitor patient outcomes in real time. Our early adopter, Clínica Universidad de la Sabana, will integrate VitAlly to its rehabilitation programs, helping us expand nationwide through evidence-based results.
We build a scalable and sustainable model that benefits both caregivers and the health system. Free basic version, accessible to anyone, includes essential training and offline resources. Premium institutional version, subscribed by EPS, insurers, and hospitals, unlocking all the features, live consultation, analytics, dashboards, and advanced models. Private user, individuals can also purchase affordable subscription directly. Revenue streams come from institutional contracts, sponsorships, and government partnerships, will maintain equitable access. Our metrics: return on investment measured through reduction in hospital readmission, user satisfaction greater than 90%, chatbot response time under 10 seconds, call center of 2 minutes, and retention rate of caregivers about 75% after 6 months of use.
At its core, VitAlly is about empowering those who care for others, because when we support the caregiver, we protect the patient and strengthen our health system. We envision a Colombia and a world where no caregiver feels lost, no patient is left unattended, and every act of care becomes an act of dignity. With your partnership, EPS, institutions, and communities, VitAlly will redefine how we care, connect, and heal, because behind every patient, there is someone who gives it their all, and they deserve care too. VitAlly, your ally in caring for caregivers and patients. VitAlly!